Mental illness doesn't always look like what you see in the movies. It doesn't announce itself. It hides behind smiles, productivity, and the comment, "I'm fine." And that's exactly why people miss it, even in themselves. Here's why this matters. 1 in 5 adults will experience mental illness in a given year. But most won't recognize the early signs because we've been taught to look for the extreme, the obvious, the dramatic. Meanwhile, the subtle signs, they get ignored, dismissed, normalized until they're not subtle anymore. And by then, the person has been suffering for months, maybe years, thinking they were just stressed or tired. So in this video, I'm breaking down 10 signs of mental illness that fly under the radar, the ones people don't talk about, the ones that don't fit the stereotype. I'm going to show you how to recognize these signs in yourself or someone you care about, not to diagnose, not to panic, but to pay attention, because mental health is health. And just like I wouldn't ignore your chest pain when you come to the emergency room, as the emergency room physician, you shouldn't ignore the warning signs your brain is giving you. Early recognition saves lives, it shortens suffering, and it opens the door to help before things get worse. Now I'm going to tell you guys a little story concerning my experience with depression. Now mind you, I'm a physician. I diagnose depression all the time in my patients. About 30 years ago, I suffered from depression. Didn't even realize it. I was so busy being busy as a young medical attending, single mom, 3 kids, and having to make it happen. But I knew I felt just a little off. I felt disconnected. I spent a lot of time in the bed while my kids were in school. Didn't really want to do a lot of things. And I didn't realize anything was wrong until it got really bad. I happened to pick up, it's called a DSM, I think it was 3 at that time. And I looked up the signs and symptoms of depression. To my surprise, I possessed each and every one of them except suicide. However, I had gotten to the point where I could understand why someone would want to commit suicide. Thank God that wasn't my thought at that time. So I sought help. I went to see a psychiatrist, and within a few moments, she recommended some medication for my symptoms. I left out of there thinking, she doesn't know me. I don't need that. And I did not fill the prescription. But guess what? I didn't get any better. So after a while, I said, let me go ahead and try this medication. To my surprise, within about 1 week, I felt the cloud lifting up off of me. I wasn't as disconnected with my surroundings and other people. So with my doctor self, I increased my dose a little bit. And within another week, I felt human again. I didn't feel intoxicated, drowsy, no change in my mental status, except that I was not severely depressed any longer. And I've shared that story with some patients over the years who were reluctant to get treatment because of the stigma around mental illness. Now, let's get clear on what we're actually talking about, because the term mental illness gets thrown around a lot, and most people have a completely distorted understanding of what it means. Mental illness isn't a character flaw. It's a medical condition that affects your brain's ability to regulate mood, thought patterns, perceptions, and behavior. It's not weakness. It's not something you can just snap out of. Just like diabetes affects how your body processes insulin, mental illness affects how your brain processes information, emotions, and stress. So here's the clinical definition. Mental illness refers to a wide range of conditions that affect thinking, feeling, mood, and behavior. We're talking about depression, anxiety disorders, bipolar disorder, PTSD, obsessive compulsive disorder, schizophrenia, eating disorders, and the list goes on. These aren't just bad days or feeling down. These are diagnosable conditions with identifiable patterns, biological components, and evidence-based treatments. Your brain runs on neurotransmitters, chemical messengers like serotonin, dopamine, and norepinephrine. When these systems get dysregulated, it changes how you experience reality. Not because you're doing something wrong, not because you're not trying hard enough, but because the hardware is glitching. Mental illness can be triggered by genetics, trauma, chronic stress, major life changes, medical conditions, or sometimes nothing you can point to at all. It just shows up. That's why people don't recognize it, because when your brain is the thing that's sick, it's also the thing you're using to evaluate whether you're sick. You're trying to use a broken thermometer to check if you have a fever. Mental illness exists on a spectrum. It's not binary. You don't either have it or you don't. Some people experience mild symptoms that come and go. Others deal with severe, persistent conditions that require ongoing management. Most people fall somewhere in between with symptoms that fluctuate based on stress, support, treatment, and a dozen other variables. And here's what nobody tells you. You can be high functioning and still be mentally ill. That was me. You can excel at work, maintain relationships, look perfectly fine on the outside, and still be drowning on the inside. In fact, some of the most successful, accomplished people are masters at hiding their struggle because they've learned that productivity is an acceptable mask, that achievement buys you the right to suffer in private. So why do the signs get missed? Why do people, smart, self-aware people, walk around with untreated mental illness for months, years, sometimes decades? Because we've been conditioned to dismiss our own experience. We compare our internal chaos to everyone else's highlight reel and think, well, I'm not that bad. We set the bar for sick enough, impossibly high. You tell yourself, I'm still going to work, so I can't be depressed. I haven't had a panic attack in public, so it's probably not anxiety. I'm eating something, so it's not disordered. We wait for rock bottom, like it's a prerequisite for help. But here's the thing. Mental illness doesn't wait for permission to get worse. It doesn't announce itself with a formal diagnosis. It creeps in through the side door, wearing the costume of normal life. And by the time you realize something's wrong, it's already redecorated your entire internal landscape. So let's look at 10 under-the-radar signs of mental illness. Number 1, emotional flatness or numbness. Depression. This isn't sadness. It's not crying or feeling down. It's feeling nothing at all. You're going through the motions, showing up to work, responding to text messages, smiling when you're supposed to, but internally, radio silence. You stop reacting to things that used to matter. Good news lands flat. Bad news doesn't register. You're watching your life happen like it's a movie you're not invested in. This is called anhedonia, the inability to feel pleasure. And it's one of the most overlooked symptoms of depression because it's invisible. You're still functioning. You're just not present. What does it look like? Someone who used to light up about their hobbies suddenly doesn't care. They're not sad about it. They're just indifferent. That indifference is the red flag. Number 2, disproportionate irritability or rage. This can be seen in depression and or anxiety. We're not talking about having a bad day. We're talking about emotional reactions that are completely outsized compared to the trigger. Snapping at your partner over dishes. Road rage over someone changing lanes. Crying or screaming over spilled coffee. Here's what people miss. Irritability is often how depression and anxiety show up, especially in men. We're trained to look for sadness, so we miss the anger. But when someone goes from 0 to 100 over minor inconveniences, when their fuse gets shorter and shorter, that's not a personality flaw. That's a symptom. What does that look like? The easygoing person who suddenly can't tolerate noise, interruptions, or mistakes. The friend who used to laugh things off now seems constantly on edge. The shift in baseline temperament is the sign. Number 3, persistent sleep disruptions can be found in depression, anxiety, and bipolar disorder. This isn't one bad night. This is weeks or months of sleep that's either too much, too little, or completely non-restorative. You're sleeping 10 hours and waking up exhausted. Or you're lying awake at 3 a.m. with your mind racing and unable to shut it off. Or you're taking multiple naps just to get through the day. Sleep is one of the first systems mental illness hijacks. It's also one of the first things we dismiss as just stress or getting older. But chronic sleep disruption is a hallmark of depression, anxiety, bipolar disorder, and PTSD. Your brain regulates sleep. When your brain is dysregulated, sleep falls apart. What it looks like. Someone who used to be a morning person now can't drag themselves out of bed. Or the person who's suddenly sleeping 4 hours a night and claiming they don't need more. Both extremes matter. Number 4, physical symptoms with no medical cause. Chronic headaches, stomach aches, chest tightness, dizziness, muscle tension that won't release. You go to the doctor, they run tests. Everything comes back normal and you're left thinking, am I making this up? You're not. This is called somatization, when psychological distress manifests as physical symptoms. Anxiety doesn't just live in your head. It rewires your nervous system, floods your body with cortisol, and keeps your muscles in a constant state of tension. Your body is screaming that something's wrong. The problem is, it's speaking a language most doctors aren't trained to interpret. What does this look like? This is someone who's been to multiple specialists with no diagnosis. Someone who's always dealing with vague, chronic pain or digestive issues. If the medical workup is clean, but the symptoms persist, look at mental health. Number 5, obsessive thoughts or compulsive behaviors, OCD and anxiety. This isn't being a neat freak or type A. This is needing things to be a certain way or something terrible will happen. Checking the stove 5 times before leaving. Washing your hands until they crack. Intrusive thoughts that loop endlessly. Violent images. Fears of harming someone. Catastrophic what-ifs that won't shut up no matter how much you rationalize them away. You know it's irrational. That's the cruelest part. You know the door is locked. You know your hands are clean. And you know you're not actually going to do that terrible thing your brain keeps showing you. But knowing doesn't stop it. The anxiety doesn't care about logic. So you check again. You count. You arrange. You perform the ritual because it's the only thing that makes the screaming in your head quiet down for 5 minutes. But here's what most people don't get about OCD and compulsive anxiety. It's not about being organized or particular. It's about your nervous system being stuck in threat detection mode, convinced that if you don't perform these specific actions, something catastrophic will happen. Your brain has essentially created a false alarm system that won't turn off. The compulsions aren't the problem. They're your attempt at a solution. They're how you're trying to manage unbearable certainty and fear. The issue is that every time you perform the ritual, you're teaching your brain that the threat was real and the compulsion saved you. So the cycle strengthens. What this actually looks like: needing symmetry or evenness so intensely that you'll redo tasks multiple times. Intrusive thoughts about harm, sex, or taboo topics that make you question who you are. Mental compulsions, counting, repeating phrases, reviewing conversations. Avoidance of triggers that slowly shrink your world. reassurance seeking that exhausts everyone around you, the guilt and shame of spending hours on rituals you can't explain. And here's the thing nobody tells you. The content of the obsession doesn't matter. Whether it's contamination, harm, religious fears, or something else entirely, the mechanism is the same. Your brain is pattern matching threats that aren't there and demanding you do something about it. You've probably tried to just stop the compulsions, tried to ignore the thoughts, white-knuckled your way through the anxiety, and it either didn't work or it worked temporarily until the trigger sent you right back. That's because willpower doesn't rewire neural pathways. You need a different approach, one that addresses why your threat detection system is malfunctioning in the first place, not just managing the symptoms it creates. Number 6, sudden changes in eating patterns seen in eating disorders, depression, anxiety. This isn't just about weight loss or gain. This is about your relationship with food fundamentally shifting, and you might not even notice it's happening. Eating becomes a control mechanism. You start restricting without realizing it, skipping meals, cutting out food groups, obsessing over clean eating to the point where it's no longer about health. Or the opposite, eating for comfort, numbing emotions with food, binging in secret, and then feeling crushing shame. Here's what people miss. Eating disorders don't always result in dramatic weight changes. You can be struggling with disordered eating at any size. The behavior shift is the sign, not the number on the scale. What does this look like? It looks like someone who used to enjoy food now has rigid rules around it, or someone who's suddenly eating alone, hiding food, or obsessing over every calorie. The person who says, "I'm not hungry" for the third day in a row. The shift from food as fuel to food as enemy or emotional regulator, that's the red flag. Number 7, risky or impulsive behavior, seen in bipolar disorder, ADHD, substance use disorders. Sudden spending sprees that blow through savings, reckless driving, hypersexuality, hooking up with strangers, cheating out of nowhere. Substance use that escalates fast, quitting a job without a backup plan, making massive life decisions on a whim. When impulse control drops off a cliff, that's not a personality quirk, it's a warning sign. This is especially common in bipolar disorder during manic or hypomanic episodes, but it also shows up in untreated ADHD, substance use disorders, and even severe anxiety, where risky behavior becomes a way to feel something. What does this look like? The person who suddenly maxes out credit cards, the monogamous partner who starts acting out sexually, the cautious driver who's now getting speeding tickets. It's not that they changed, their brain's executive function system is compromised. Number 8, cognitive fog that won't lift, such as in depression, ADHD, anxiety, or brain-based conditions. There's trouble concentrating and the forgetting of conversations you just had. Reading the same paragraph 5 times and still not retaining it. Missing details you would normally catch. Difficulty making even small decisions, what to eat, what to wear, whether to respond to a text. This isn't getting older. This isn't just stress. This is often a symptom of depression, which slows cognitive processing, or anxiety, which hijacks working memory, or ADHD, which was previously compensated for but no longer is, or early signs of other neurological conditions. Your brain is struggling to do basic tasks that used to be automatic, and because it's gradual, you might not notice until someone points out you've asked the same question 3 times, or you realize you've been staring at your to-do list for 20 minutes without starting anything. What it looks like. The sharp, detail-oriented person who suddenly is making careless mistakes at work. The reader who can't finish a book anymore. The conversationalist who keeps losing their train of thought mid-sentence. When cognitive function declines noticeably over weeks or months, pay attention. Number 9, withdrawing socially but still showing up. This is seen in depression, social anxiety, PTSD, and burnout. This one's tricky because it doesn't look like classic isolation. You're still going to work. You're still showing up to family dinners, but you're physically present and mentally absent. You used to initiate plans. Now you only go when dragged. Conversations feel exhausting. You're saying yes to everything because you're terrified of being alone with your thoughts. Or you're saying no to everything because people feel like too much. Both extremes matter. Here's the subtle version. You're in the group chat, but never responding. You're at the party, but you're leaving early. You're smiling in photos, but feel completely disconnected. It's not that you don't care about people. It's that connection requires energy you don't have, or vulnerability that feels too risky. Social withdrawal and mental illness doesn't always mean staying home alone. Sometimes it means showing up but building walls, keeping conversations surface level, canceling plans last minute with vague excuses, avoiding eye contact, sitting in a crowded room and feeling completely alone. Depression tells you that you're a burden, that people don't really want you there. Social anxiety tells you that everyone's judging you, that you're going to say the wrong thing. PTSD makes crowds feel unsafe. Burnout makes human interaction feel like one more task on an impossible to-do list. What does this look like? The extrovert who suddenly stops making plans. The friend who used to text but now takes days to respond. The coworker who used to join lunch but now eats alone at their desk. The person who's too busy for everything but you know they're just sitting at home. The shift from engaged to withdrawn, even if they're still technically showing up, is the red flag. Because isolation feeds mental illness and mental illness feeds isolation. It's a vicious cycle that starts so gradually you don't notice until the person has already disappeared emotionally, even if they're still physically there. And lastly, number 10, feeling disconnected from reality, as in dissociation, PTSD, psychosis, and severe anxiety. This is one of the most unsettling symptoms and one of the most dismissed. It's called dissociation, and it feels like you're watching your life through glass, like you're a passenger in your own body, like nothing is quite real. You're in a conversation, but you can't track what's being said. You're driving and suddenly you're at your destination with no memory of how you got there. You look in the mirror and don't recognize yourself. Time feels distorted. Hours pass like minutes, or minutes drag like hours. You feel detached, floaty, like you're observing your life instead of living it. And here's what people don't realize. Dissociation is your brain's emergency shutdown mechanism. It's what happens when reality becomes too overwhelming, too painful, or too threatening to process in real time. It's common in PTSD, severe anxiety, panic disorder, and trauma survivors. It can also be an early sign of psychosis or dissociative disorder. Some people dissociate in small moments, zoning out during stress. Others lose chunks of time or feel like they're living in a fog for days. Both matter, and both are your brain telling you it is overloaded. What does this look like? It's the person who's spacey all the time. The friend who asks, wait, did I tell you this already? Because they genuinely can't remember. The coworker who seems present, but their eyes are somewhere else. The partner who describes feeling numb or not really there. If someone tells you they feel disconnected from their body, from reality, or like they're watching themselves from the outside, that is not normal, that is a symptom, and that needs attention. Here's what I need you to understand. I didn't just treat my depression with therapy and medication, I brought it to the Father. And that changed everything. Around the same time I was in that dark place, I accepted Jesus into my life. I started reading the Word daily, not as a religious obligation, but as a lifeline. And I can tell you, without a shadow of a doubt, being immersed in Scripture played a significant role in my healing. It reminded me that God brings joy in the morning, that He gives beauty for ashes. When I couldn't sleep because my mind was racing, I held on to the truth that He never sleeps or slumbers. So I could rest, knowing He was holding me even when I couldn't hold myself. Mental health treatment is medical. It's necessary. But for me, it wasn't complete without the spiritual piece. God didn't heal me so I could skip going to the doctor. He walked me through the treatment. He used therapy, medication, and his word together to restore me. And if you're struggling right now, I want you to know you don't have to choose between faith and treatment. You bring both. You get the help and you let God meet you in it. Because he's not waiting for you to fix yourself first. He's with you right now in the middle of the mess, offering beauty for your ashes. If 3 or more of these signs showed up for you consistently, not just once, talk to someone, a therapist, your doctor, a crisis line. Start with your primary care physician if that feels less intimidating. We screen for mental health conditions routinely. You don't need a breakdown to justify the appointment. You need persistent symptoms that are affecting your life. That's it. If you recognize these signs in someone else, here's the move. Don't wait for them to bring it up. They probably won't. Instead, name what you're seeing without diagnosing. I've noticed you seem more withdrawn lately. Is everything okay? Or, you've mentioned being tired a lot. Have you talked to anyone about that? You're not accusing, you're opening a door. Sometimes that's all someone needs to finally say it out loud. And if you're thinking, I'll just keep an eye on it, let me be direct. That's how people end up in crisis. Monitoring without action is just prolonged denial with extra steps. Mental illness does not reward patience. It rewards intervention. The earlier, the better. Always. There's no award for toughing it out. No bonus points for waiting until you can't function. The goal isn't to prove how much you can endure. It's to stop enduring unnecessarily. You wouldn't let a bone that was broken heal crooked just to avoid somebody like me. Don't do that with your brain. One last thing. If you're still not sure whether what you're experiencing counts, that uncertainty in itself is telling. Healthy people don't spend weeks wondering if they're okay. They just are. And if you're questioning it, if you're here watching this video searching for validation, you already know something is off. Trust it. Mental health, as I said before, is health. Full stop. And just like you wouldn't ignore chest pain or persistent headaches, you don't ignore persistent changes in mood, sleep, energy, or thinking. The signs don't need to be severe to be significant. They just need to be there consistently, changing how you move through your life. So pay attention, take it seriously, and get help before you're desperate for it. Because you deserve to feel okay, not just functional, not just surviving, but actually okay. And that starts with recognizing when you're not. If this resonated, share it. Someone in your circle needs to hear this. And if that someone is you, I'm glad you watched. Now let's go do something about it.